Hello, class. This is Natalie Franco, and this is my discussion number 2. So, here we have our patient, which is a 68-year-old Asian man who presents to the ED complaining of having red eyes that are painless with clear drainage for the past 3 days, along with a mild headache with low grade fever, sore throat, nasal congestion, and ear fullness with popping, but denies ear pain and drainage. His vital signs are a little elevated. He has a blood pressure of 179 over 89, heart rate of 101, respiratory rate of 21, 93% uh, oxygen saturation in room air, and he has a low grade fever of 100.4. So, starting off, um, with our demographics and risk factors, we have a 68-year-old Asian male with a history of hypertension, hyperlipidemia, peripheral artery insufficiency, and seasonal allergies. These are all risk factors. He also smokes a pack of cigarettes a day and drinks 1 to 2 beers a night for 4 to 5 times a week. His signs and symptoms are he has the red eyes, um, with the clear drainage that is painless for the past 3 days. He reports that mild headache with a low grade fever, sore throat, and nasal congestion, and also has that ear fullness and popping. Um, for the for the time course and pattern of the signs and symptoms, it's been going on for the past 3 days. For my differential diagnosis, I have 4 different differential diagnoses. So my first one is there has to be an infection somewhere. He has a headache, he has a fever, sore throat, his vital signs are elevated, his heart rate, uh, he has that low grade fever. So, according to my reference, there is an infection, there could be an infection present, and the culprit could be, influenza, mononucleosis, or strep throat. My second differential diagnosis is allergies. Both of his eyes are red with that clear drainage. He has that nasal congestion. That could just be part of his seasonal allergies. My third differential diagnosis is for the ear fullness and popping. This could be otitis media. Otitis media may make you feel like your middle ear is full. Um, and my reference says that is very common for people who smoke, who have seasonal allergies, and who have an upper respiratory infection to get otitis media. My last differential diagnosis is COVID-19. And nowadays, it's every symptom in the world can be a sign of COVID-19. So you can associate that with the headache, fever, sore throat, the red eyes, and the elevated vital signs. It could be a possibility of COVID-19. So definitely the best way to guarantee that is to get tested, to do the test for COVID-19. For the last section on how does your nursing experience influence your clinical judgment, I've been a nurse for almost 10 years. I've been everywhere from ICU to step down unit to um, a burn step down trauma unit to my latest surgery. I've seen a little bit of everything. I also have a 3-year-old daughter that comes home with all sorts of things, which some of these symptoms are similar. Um, so all these things that I've seen, helps me come up with these differential diagnoses. Um, and that's it. Thank you so much for listening. Have a great day.